Hello and a very good afternoon to all of our viewers who are joining me in this live interaction on Facebook and YouTube as well. And today I will be speaking about how people with substance use disorders can be more susceptible to COVID-19. But before that, let me give you a brief introduction of today's topic. Now, with each passing day, the number of cases in India is only on the rise, and we are seeing record spikes almost every alternate day. Along with that, every day, a new study surrounding COVID-19 continues to emerge, new symptoms, and the vulnerability group keeps changing with the new studies. So, in the latest, the ones at highest risk are highly susceptible to COVID-19 are those with substance use disorders or SUDs. And this group includes those who excessively use tobacco, cocaine, alcohol, cannabis, and other synthetic drugs. And this particular study, which I'm talking about today, was conducted by researchers based out of the United States. So what did the report actually say? So the report said that people with substance use disorder or SUDs, including those who excessively use tobacco, alcohol, opioid, cannabis and cocaine, are more susceptible to COVID-19 and its complications. So the research, which assessed the electronic health records, noted that healthcare providers should closely monitor patients with SUDs and develop action plans in order to help shield them from the infection and severe outcomes. So according to the researchers, including those from the National Institute of Drug Abuse in the US, individuals with SUD constituted 10.3% of the total population which was studied by the researchers. But the 10.3% of the study population represented close to 15.6% of the COVID-19 cases. And the researchers also safeguarded the privacy of these individuals by de-identifying them on the EHRS. And the scientists also said that these individuals were not just susceptible to COVID-19, but the effect was also much stronger for the opioid users. The next vulnerable group in the SUD category was the ones who used tobacco excessively. So now, in order to answer a few questions, we have with us Dr. Sitesh Roy joining us live from Mumbai. Many thanks for joining me in this live interaction, Dr. Sitesh. And my first question to you today is, what is the kind of threat these people with SUDs usually face when it comes to COVID-19?
So Deepak, people who have substance abuse disorders generally have a compromise in their respiratory and cardiovascular system. This is a well-known fact and we have known it for years together. So for example, if someone is a smoker and a moderate smoker for that matter, there is a high chance that their lung capacity and their lung functions will be lower than someone who is a non-smoker. There's also a higher chance that a heavy smoker will go on to develop something called chronic obstructive pulmonary disease, called COPD for short. Similarly, someone who consumes a lot of alcohol has a higher chance of having liver diseases and having inflammation in the body. And similarly, opioids, cannabis, all of these become inflammatory triggers for the body. Now, if someone has inflammation and has any kind of chronic imbalance in the body of their immune system, their hormonal system, which all are affected by drugs and substance of abuse, there are chances of contracting the virus, the SARS-CoV-2 virus, and then getting sicker than another person their age and of their profile who is a non-substance user will always be higher. And I think that this can be tracked down to many other diseases, but especially is true for COVID-19. We have always known that people who consume alcohol a lot are more prone to getting infections. This is a very old knowledge in the medical profession. That also has to do that these people tend to have imbalances in their immune system due to their substance use. When we look at the risk for going into the ICU or going on a ventilator, this also tends to be higher for people who have a chronic and long history of substance use, tobacco, alcohol especially, and all the other drugs certainly would do even worse harm because they have a bigger impact on the body. So I think that this is something that we have kind of known and suspected, but now we have proof that this is truly the case.
Also, doctor, now before I ask you my second question, let me give our viewers another piece of information about this particular research. So, in the research, the scientists assessed the health data of over 73 million patients, of which 7.5 million people and above had been diagnosed with SUD at some point in their lives, and this was claimed by the researchers. So they said that slightly more than 12,000 of the patients were diagnosed with COVID-19 and about 1,880 had both an SUD and a COVID-19 diagnosis on record. So the complicating effects of SUD were visible in increased adverse consequences of COVID-19, and it noted that hospitalizations and also the death rates of COVID-19 patients were all elevated in people with recorded SUDs compared to those without. So, doctor, my second question to you is, what are the consequences that people with SUDs would have to endure, and how harmful is it?
So, Deepak, if we take the most common example of tobacco use, we certainly know that the risk of cancer, COPD, heart disease, oroesophageal, the entire food pipe, mouth, all these areas get affected by the 400 plus toxins that are there in cigarette smoke. And as a consequence of that, as I said, even the lung immunity, if someone is inhaling whatever substance they are using, they are inhaling it into their respiratory tract. Cocaine might be going up someone's nose and inflaming it. The tobacco smoke goes into the nose, sinuses, lungs, and in all these areas, it basically reduces the local immunity, reduces the ability of the body to clear a virus that is trying to enter it. Even the lining, the mucous membrane, that is the first protection, the first physical barrier that keeps something harmful out of our body. The mucociliary clearance, that is also affected. The tiny hair that push things that are not right out of the body, even those are not functioning right in these people. So recognizing that any kind of substance use, even if it is in the distant past, so we know that after a smoker has even given up smoking, their risk for developing lung cancer does not go down for 15 years after they have quit smoking. So till 15 years after stopping smoking, their risk of developing lung cancer is still higher than the general population. So in this entire cohort, even if there were some people who were not currently using were abusing substances of addiction, but they were doing it in the past, still their body may have been in a compromised state and hence not be able to fight back the virus like it should and prevent the complications or the progression of the disease like it should.
Also, doctor, now, as you know, every day in the news, the Bollywood and the sandalwood has the reputation of these two industries has been marred by substance use. So when it comes to the COVID-19 situation and people are involving themselves in substance use, what message do you have and how harmful is it for them?
So first of all, I think the biggest message is, if you keep any of these people who are actually using substances of abuse as your role models, please reassess your idea of a role model, because, and I'm not judging or labeling anyone, because what looks glamorous on a screen may not be as glamorous in real life. So the first big message is, whom are you idolizing or following? The second message is, if they are doing it, they will pay the price in their own way, health-wise or otherwise. Don't follow them and start doing the same thing. And I think that the youth and people of all ages need to realize that substance abuse, whether it is tobacco, whether it is alcohol, whether it is drugs, whether it is methamphetamines, ecstasy, anything it might be, it's a very temporary joy or happiness with a very long-lasting harmful effect on the body, mind, and the person in general. And those few minutes of pleasure certainly are not worth the risk for health. And now COVID-19 turns out to be the latest risk that people are taking if they are using any of these substances. So the biggest clear message, say no, stay away. Not even the mildest, even if everyone around you is doing it, the risk is just not worth it. It's not worth taking these risks with your health and your life.
Right, doctor, thank you for joining me with all those details, and your last few words really struck a chord in me. So, but for the others, it still remains to be seen whether they would, idealize people who are into drugs and would carry on with the habits that their idols are pursuing and later get into trouble. Like the doctor clearly said, substance abuse and consuming alcohol or even tobacco excessively will reduce your immune response power, and we need immune response power in this COVID-19 situation, because this is the only thing that can help us stay away and also ward off COVID-19 even if we have an infection. So immune response is very important, and those into drugs, please, like the doctor mentioned, stay away from drugs and stay clean, because COVID-19 is here to stay. Until we have a vaccine, we will have to follow all the healthy habits that we have never followed before, and we should also keep in mind all the safety and precautionary measures. So if you guys have liked this piece of information, please drop in your comments, and also like, share and subscribe to News 9 on various social media platforms. Thank you for watching.